Hi, welcome. I see we have you in for an ear, nose, and throat exam today. Come on in and have a seat. So, are you having any discomfort today, or is this just a general checkup? I don't see you as a referral in from any other doctor. Just a general checkup. Wonderful. And this should be very quick, easy, and completely painless. Have you ever had an ENT exam before? No? Alright, well, they're very easy. I'm just going to be examining your ears, nose, and throat. Alright? It's going to be very simple, very painless. And if we find anything, we'll take care of it, okay? So, have you noticed any abnormalities in your sense of hearing lately? Anything sounding duller? Are any lower or higher pitches becoming indiscernible to you? No? Okay. That's good. And do you hear things equally in your right and left ear, to your knowledge? Good. We'll test that today anyway. And how about your nose? Any loss of smell at all the past 6 months? Any illness? Okay, that's good. We always want to be on the lookout to make sure you don't lose your sense of smell. You'd be surprised how much that impacts your life, honestly. And how about your throat and your sense of taste? How's that been? Any issues? Chewing, swallowing, tasting anything? No? Wonderful. Then this should be very easy. Alright, so to begin the exam, we're going to look at your ears, okay? So I need you to just hold very still. You can look wherever you'd like, close your eyes if you'd like. It's not a problem. I'm just going to come over here and I'm just going to inspect your ear. Just going to gently squeeze and touch around the outside here. Make sure that everything looks good on the outside. Good. And I'm going to do another inspection on this one over here. Just again, palpating gently. Just looking for any obvious issues. Okay. Now, I'm going to take my otoscope here, and we're going to take a look inside those ears, okay? Just hold still for me, relax. Just going to gently slide the otoscope in, and just gently look around. Just looking for any issues. You do have a bit of wax buildup. We definitely are going to recommend you for an ear cleaning. That's okay. There's nothing to be ashamed about. Really, there's nothing you can honestly do to prevent sometimes getting a blockage. Some people just make more earwax than others, and some people have bad Q-tip habits that shove them very deep inside, and that can cause a blockage if you do that too often. But sometimes it just happens. Don't be embarrassed. We get you scheduled for an ear cleaning. Not a problem. And now we're on this side here. Just going to look inside gently sliding it in. Okay. Yeah, everything looks good. Just you do having a bit of a blockage here that looks just like earwax though, so that's good. Well, if you had told me you'd been having a few hearing issues, I would have believed you with that much earwax in that ear, but if you still are hearing okay, then I think it can go another few days, no more than a week, before I want to see you back for an ear cleaning in here, okay? You make sure you stop and schedule on the way out. But otherwise, it doesn't look too bad. So, what I want you to do, look straight at me. I'm going to palpate each ear at the same time, and I want you to tell me as long as it feels the same, okay? Alright, and here we go. I'm just gonna squeeze. Good. Squeeze. Good. Squeeze. Good. And just gonna rub them gently. Good. And when I cup them, okay, good. Okay, so now we're going to do a little bit of a hearing test for you. So what I want you to do is just close those eyes for me. I'm going to make a sound in one of your ears, and I want you to let me know which ear it is, okay? Here we go. Good. 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 Wonderful. Good job. Very good. 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 I want you to keep those eyes closed for me. Keep them closed. Keep them closed. Keep them closed. And we're going to do something very similar, except this time I'm going to whisper a word in your ear, and I'd like you to repeat it back to me. All right. Sleep. Good. Dreamer. Good. Relax. Good. Drift. Good. Away. Good. Do. Good. Sleep. Good. You can go ahead and open your eyes. Well, hearing test seems good so far. Do you want to do one more thing, which is just test the sensation around your ears. So I have a metal object here that's kind of cold, and I have a cotton swab here that is just room temp warm. I want you to close your eyes. Let me know if you feel the cold or the warm on your ear, okay? Very simple, very easy. Close those eyes. Here we go. And cold, very good. Warm, very good. Warm again. Cold, good. Warm. Cold, very good. You can go ahead and open your eyes. Well, so far I have to say, your ears look to be in very healthy condition. Just want to get you in ear cleaning soon. Very soon. Like, very soon. But other than that, I think you're good to go. So we're going to move on to the next portion of the exam, which is the nose. Everybody's favorite part to have examined. I know, not super fun, but it's very simple, very easy. So what I want you to do, look right at me. Right at me. And I'm just going to come up here and I'm going to just palpate down your nose, right from your T-zone. And you let me know if this hurts or feels uncomfortable at any time. I was going to palpate gently under your eyes, right on the sinuses, checking for any inflammation, any tenderness, any pressure, any pain, discomfort. Good. We don't want any of that now, do we? No, we don't. You're doing such a great job. Good. Good. And over right by here. Good. Very good. All right. Now this might get a little bit awkward, but I'm going to need you to tilt your head back for me. I need to take a look up your nose. Hopefully I don't see anything. We're going to get a little more invasive, but I'm sure I'll be fine. So head back. Here we go. Just going to look up one nostril there. Good. Same. Quick and easy. No problems. Very good. Good job. No issues with the nose. How's your sense of smell been lately? No loss? Okay. I don't see any inflammation, so there's not really a need to do a smell test. Can you smell some of the sterile cleaning chemicals in the office? Yeah? Then you're fine. So we're going to move on to the throat portion of the exam. Alright, so I'm going to be examining your throat on the outside, checking your glands, looking inside your mouth, checking your uvula, looking at your back of your throat here, looking at your tonsils. Do you still have tonsils? I should know that first. You do? Okay. So I'll take a look at your tonsils, make sure those are in good shape, or if, they have any kind of tonsil stones or anything like that. And, if we might have a little time, we might be able to get all that wax out of here. What do you think? All right, great. So first things first, examine your throat. So just look up a little like this. I'm just going to come up here and I'm just going to feel. Just going to feel around your neck. I'm not going to squeeze, but I'm gently going to pulse, palpate, and just press a little. I'm going to hold on to the side of your throat here, and I want you to just swallow. 1, 2, 3, swallow. Good. One more time. 1, 2, 3, swallow. Good. And on the other side here, again. 1, 2, 3, swallow. Good. And again. 1, 2, 3, swallow. Good. Just gonna check your jaw a little bit. Just feel around. Feeling your gland and your lymph nodes. Not really feeling anything abnormal here, which is good. Good. So that looks good so far. Turn your head to the side for me like this. Okay. And the other side. Okay. And can you put your neck down like that? Good. Turn to the right. Left. Throw your head all the way back. Good. Ear to the shoulder. Good. Ear to the other shoulder. Good. All right. So let's take a look inside. Now for this, I am going to have to use everybody's favorite tongue depressor. And I will not make you gag, I promise. But I do need you to open up for me. So say ah, 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 ah. I'm just going to point my light down. Looking around your mouth, looking for any obvious signs of disease, damage, anything like that. Do you smoke? Okay, good. Your uvula looks good. Yeah? Okay. Tonsils look pretty good. Back of the throat, a little red. You experience any postnasal drip often? A little bit, okay. Otherwise, looks pretty good. Nothing that I find concerning. You have been an absolutely wonderful patient today. Thank you so much for that. But good news is, we do have a little extra time. So we can at least get the wax, some of the superficial loose stuff out of one of your ears. How about that? You want to take care of that right now? All right. That won't be a problem. So all I'm going to do is take this little tiny bottle of hydrogen peroxide and a cotton swab, and I'm going to get the outer area. We're going to have you in for a longer ear cleaning where I can really get in there and flush out both your canals. But for now, let's just get some of that superficial stuff on the outside. Hopefully it'll clear your hearing up a little bit, and I'll keep you going until we get you back in for a deep cleaning, okay? All right. Just hold still for me. I'm going to come over here and just a little bit of hydrogen peroxide, and then cotton swab on the outside. Not really going in the ear canal, you know. We don't want to push that wax deeper. I just want to see if we can clean up some of this stuff here. Good. It's all right. Let me know if it hurts at any time. We want to make sure that you are completely comfortable and relaxed. That outside looks a little bit better. Let's get this one over here. Just a little. There we go. I know it could feel a little bit weird. We're just gonna, as I said, clean on the outside. Just get some of that wax out of there. You know, the ear sheds wax naturally, so normally it'll just flow out of your ear, and most people don't even notice. Happens a little at a time. But sometimes we can build up. As I said, it's nothing to be embarrassed about. Happens. Can happen to anybody. But we'll take care of that for you. So, I think for today, you're all set. I appreciate you coming in. As I said, ear, nose, and throat look fine. We do need to get you in for a deep ear cleaning, but outside of that, I think you're okay. All right? So I hope you have a wonderful rest of the day, and we'll see you soon for that ear cleaning. Bye-bye.